Hi, my name is Dr. Gregory Kramer. I'm a diplomat in the American Academy of Medical Legal Professionals. Today we're going to talk about chronic neck, back, and leg pain. If you or a loved one is suffering from chronic neck, back, or leg pain, this information is designed to end the suffering. This is a brief 6-minute intro, and if this information makes sense to you, log on to Contact Us and we will send you a free 30-minute DVD explaining everything you need to know to end your chronic neck, back, and leg pain nightmare. Now, before I begin, there's a couple things. Number one, 90% of this information is new, so really listen closely. Number two, you might be thinking, I've tried all kinds of treatments with no success. Many of the patients you'll see, the testimonials, have been there. They've been to chiropractors and medical doctors and physical therapists and acupuncturists and massage therapists. They've had CAT scans, they've had MRIs, they've had blood work, and either they say everything's wrong or they say nothing's wrong. Well, guess what? These same patients that have been suffering for years, some of these patients that you'll see the testimonials have been suffering for decades, yes, decades, and they thought they would never, ever get well. And guess what? Now they're well. They live active, full lives. They're productive members of society. They're able to participate not only in their hobbies, their work, but with their kids and grandkids. That can be you too. This new advanced treatment has helped people that I've never thought I could help 20 years ago. So what I'd like to do is cover a few basic things. One of the things that people have trouble with chronic neck or back pain is they're wondering, is it a muscular problem? And the answer is typically no. The pain with chronic neck and back pain is generally not coming from the muscles. If it was, your problems would be brief, you get a massage, and it would go away. These are chronic problems. Usually, they're troubles within the disc, they're in the ligaments, and we can take certain x-rays to actually measure that. There's research to show that when someone has a chronic pain, usually their spine is very far from normal. You basically, just like you were told in high school anatomy, your spine should be straight from the front, and from the side view you should have curves. Well, those curves should be about 40 degrees. When you lose those curves, guess what? You don't absorb shock as well. And every step you take, every exercise that you make puts unequal pressure. Unequal pressure on those joints can cause wear and tear and chronic pain. Now, many people, when they suffer with pain, they can't sit. They have difficulty walking, or their legs get numb. They have difficulty turning their head. It's very hard for them to maybe work on a computer. They don't sleep well because they're constantly rolling in bed over and over in pain. These are common symptoms. You probably have a bucket full of pills that you've tried, and they might give you some relief. It usually doesn't last too long. Now, one of the things that we find, the cause of this, not only from a structural point of view, structural means how your body's lined up. We find that your ability to move is compromised, so we're going to do some movement tests. We find that your posture is altered, and we're going to measure your posture. But one of the common things we find is that parts of the brain, yes, parts of the brain aren't functioning the way they should. Let me give you an example. The back part of your brain, called the cerebellum, controls the front part, which then sends a message to the lower brainstem. If the cerebellum sends the correct information, your lower brainstem is stimulated and is able to quiet down the upper brainstem, called your mesencephalon. The mesencephalon then is overstimulated. What happens is, if one part of the brain is sluggish, another part of the brain, it works too much. So your body's in a constant state of fight or flight. And that's why one of the major reasons your body is not healing. So not only with chronic back and neck pain, chronic leg pain, chronic sciatica, you probably have trouble with digestion. You probably have trouble with sleeping. You might have some trouble with dizziness. You may also have some trouble, for instance, with short-term memory. When these parts of the brain aren't functioning properly, it leads to a host of other conditions besides chronic neck and back pain. Another thing that happens when people have chronic neck or back pain, they suffer with something called allodynia. What does that mean? That means you feel pain from things that shouldn't cause pain, from non-noxious stimuli. What does that mean? That means your neck hurts when you wear a necklace. Now, your neck shouldn't hurt when you wear a necklace. That tells me that your pain is neurogenic. It's coming from the nerves. It's brain pain. Or some people say, my eyeglasses or my hair even hurts. That's not normal. So if you have chronic neck or back pain and your clothes hurt you, your belt hurts, things that should not hurt you do hurt you, that tells me that you have a neurogenic problem. Now what's the solution? The solution, number one, is, first thing is, we treat people, individuals, not labels. So no matter what your label is, whether it's a herniated disc, a bulging disc, stenosis, we treat you as the individual. And if you're listening to this webinar, that means your doctor did not treat you as an individual. You probably just treated your diagnosis. And if that was correct, you wouldn't be listening to this. Number two, we're going to do a thorough, and I mean thorough, an evaluation like you've never had before. A functional neural structural evaluation. We're going to check your posture, we're going to check your nervous system, we're going to see your balance, we're going to check your strength, we're going to do different tests that you probably have never had done before. Number four, we are going to also look at you metabolically. What does that mean? That means, in my experience, people with chronic pain, there is a nutritional component to it. And that the only way to find this out is to test. You have guessed long enough with your problems. So blood test, urine test, saliva test to determine which part of your body is deficient. And where we see the deficiency, we then supplement it nutritionally with certain supplements. Also, we're looking to find, are there certain foods that create an inflammatory state that you're sensitive to? Because if you're sensitive, an example, to wheat, you're going to be constantly inflamed, and that's going to be making you sick, and it's not going to allow your body to heal. So in order to get the best possible results, we have to do a neural structural evaluation with a metabolic evaluation. And in doing so, we get phenomenal results, and that's what we call brain-based therapy. Now, if this brief webinar made sense to you, I thoroughly encourage you to log on to Contact Us, and I will promptly send you a free 30-minute DVD on how to end your chronic neck, back, and leg pain nightmare. I'm Dr. Gregory Kramer, wishing you better health.